One of the most common phrases I hear from women, especially those over 40, is, "Oh, it's just hormonal. A little breast tenderness here, a dull ache there, maybe some heaviness or occasional swelling." And because these sensations are familiar, cyclic, and frankly inconvenient to think too hard about, most women file them under normal and move on. But what if I told you that pain isn't always just a passenger in the hormonal roller coaster? What if, in some cases, it's your body trying to tell you that something deeper, something more serious might be unfolding? Let's be honest with ourselves. Most of us are taught to downplay discomfort. From an early age, women are conditioned to be tolerant, to push through, to nurture others even while quietly ignoring their own pain. And so when the body whispers through breast pain, we often don't just ignore it, we normalize it. But here's the truth: enters breast pain that persists, localizes, or feels different than your typical premenstrual pattern deserves your attention. It may not mean cancer, but it absolutely means your body is trying to start a conversation. And your job, your responsibility is to listen. Now, let's be clear, not all breast pain is a red flag. Hormonal fluctuations can cause tenderness, especially around menstruation, perimenopause, and even due to certain medications. This is called acyclical pain. It usually affects both breasts and comes and goes in rhythm with your cycle. It's uncomfortable, yes, but generally predictable. The pain I want you to pay attention to is as non-cyclical. This is pain that happens in just one breast, in a specific area, and lingers for weeks, even months, without obvious cause. Sometimes it's sharp, sometimes it's burning, and sometimes it's just an unsettling pressure that doesn't feel familiar. You might be tempted to say it's your bra, or maybe you slept wrong, or you pulled a muscle. But if that pain sticks around, don't dismiss it. In some cases, localized breast pain is associated with inflammatory breast cancer, a rare but aggressive form of the disease that doesn't present with a lump. Instead, it shows up with pain, redness, and swelling that many women confuse for an infection or injury. This cancer often gets missed in its early stages precisely because its symptoms don't fit the standard image we've been taught to expect. And that's the problem. We've trained women to look for lumps, but not to listen to pain. Even more subtly, pain may occur when a tumor is pressing against healthy tissue or when dense breast tissue begins to shift in structure. Some women describe a strange sensitivity in just one quadrant of the breast. Others mention a feeling like bruising, even though there's no injury in sight. These aren't always signs of cancer, but they're certainly signs of change. So why do so many women ignore them? The answer is partly psychological. We're afraid. We don't want to know. We'd rather wait until it's unmistakable, until a lump forms, until the skin changes, until we're forced to face the fear. But waiting for certainty can be the very thing that takes away our options. In breast cancer, early detection saves lives. And the first sign is not always something you can see or feel with your fingers. It might be a feeling you've been brushing off for weeks. The other part of this avoidance is cultural. Many women were never taught to view pain as diagnostic. Pain is seen as something to endure, not investigate. But the truth is, pain is information. It's a signal. It's a request from your body for attention. And in a world where women are expected to care for everyone else first, that call often goes unanswered. This is where I challenge you to reframe your relationship with your body. Don't just tune in when something feels broken. Tune in when something feels different. Let go of the idea that you're being paranoid or dramatic for wanting a mammogram, an ultrasound, or even just a clinical exam for one-sided breast discomfort. You are not overreacting. You are taking ownership. And if you're someone who's always said, "I don't have a family history, so I'm probably fine," please remember this. Most women diagnosed with breast cancer have no family history. Genetics are only part of the story. The rest is awareness, listening, asking questions, acting without delay. So if you've had lingering pain, even if it seems minor, even if it feels silly to bring up, talk to your doctor. Get it checked. Because your health is not just your responsibility, it's your right. And your body, believe it or not, is on your side. It wants you to know. It wants you to heal. It just needs you to stop dismissing its signals. Ask the pain you ignore today could be the signal that saves your life tomorrow. Don't silence it. Honor it. Listen, investigate, And act to assess, we often think of the skin as something purely aesthetic. We moisturize it, cover it, dress it up. It becomes our interface with the world. What others see, what we use to project confidence or conceal fatigue. But what if I told you your skin is more than a beauty marker? That it's a biological messenger, a diagnostic canvas, revealing what's going on beneath the surface, sometimes long before any medical scan can. Nowhere is this truer than with breast cancer. One of the most overlooked, yet telling signs of early breast cancer isn't a lump, it's a change in the skin. And the reason it's often missed is simple. It doesn't look like what we expect. It might be subtle dimpling near the nipple or on the side of the breast. It might be a slight thickening that feels like an orange peel. It might be a patch of redness or swelling that doesn't go away. And because these changes are quiet, gradual, and not painful, they're often dismissed as skin irritation, insect bites, maybe even aging. But let's pause here. If you were to see these same changes on your face, a patch of puckered skin, some redness that didn't fade, an area that began to feel firmer than the surrounding tissue, would you ignore it? Probably not. You'd check it, monitor it, maybe even Google it. But when it happens on the breast, the psychology shifts. Many women hesitate. There's embarrassment, fear, even denial. Some tell themselves they're imagining things. Others assume it's from a tight bra or a scratch or the weather. But here's what I need you to hear, especially if you're over 40 or postmenopausal. Says any persistent change in breast skin texture, shape, or appearance should not be overlooked. It says your skin is not lying to you. It's speaking for the deeper structures underneath, structures that may be undergoing silent transformation. Inflammatory breast cancer, for example, often doesn't form a lump at all. Instead, it begins in the lymphatic vessels under the skin. It blocks drainage, causes swelling, redness, and dimpling. These changes can develop quickly, sometimes within weeks, because they resemble a rash or infection. Many women try to treat it at home, often wasting precious time. Now, let's step back and consider the deeper question. Why do we ignore our skin signals when they appear in such intimate, vulnerable places? The answer, in part, is cultural. Women are taught from a young age to be modest about their bodies, to hide what makes them feel uncertain. There's also the very real fear of what a change might mean. We associate skin changes with aging and aging with loss of beauty, loss of control, loss of health. And yet, paradoxically, it is only by noticing these changes that we reclaim control. There's something philosophical here too. Your skin, especially the skin of the breast, is an emotional landscape. It's tied to femininity, to motherhood, to identity. When something begins to shift there, the reaction isn't just physical, it's psychological. We resist the idea that something could be wrong because we don't want to redefine our sense of self. But I urge you to flip that script. Noticing these signs doesn't make you fragile, it makes you powerful. Because acting early gives you options. It gives you time, it gives you choices. From a clinical perspective, the skin is often the first visible alarm. Dimpling may indicate a tumor pulling on the connective tissue from within. Thickening can signal inflammatory processes below. Inverted pores, redness, or darkening of the skin can all be early signs of malignancy pressing its presence outward. These are not cosmetic concerns, they're biological clues. And they matter. So I want you to begin looking at your body differently. Not with fear, but with informed attention. Stand in front of a mirror once a month and do a full visual check. Raise your arms. Look at the sides of your breasts. Observe the nipples. Examine the skin. Don't rush. This is not vanity, it's vigilance. Don't let embarrassment block your awareness. Your body is yours, it is wise, and it is always giving you signals, sometimes loud, sometimes soft, but always with purpose. I've seen women ignore these signs only to be diagnosed later when options were fewer. And I've seen women catch them early, giving themselves the greatest gift of all time. Time to heal, to treat, to recover, to live fully. So the next time you see something that looks off on your breast, even if it seems small, even if it's not painful, ask yourself one question. What is my skin trying to tell me? Because in many cases, that quiet message may be the most important one your body will ever send. The mirror doesn't lie, and neither does your skin. Pay attention to the signs you can see before they become the battles you must fight. There's a moment that happens in many exam rooms. Quiet, tense, almost invisible, when a woman mentions something about her nipples, but with hesitation, a change she noticed but didn't talk about, a subtle shift in color, a little fluid, maybe clear, maybe pink, or the nipple pulling inward when it never did before. Sometimes it's phrased like a question, is that normal? And too often, that question is asked months after the change first appeared. The truth is, when it comes to breast cancer, was the nipple is one of the most underobserved, under-reported sources of early warning. And yet, it holds some of the clearest clues that something beneath the surface is evolving. Let's begin with something simple but important. Os nipple discharge. It may be clear, milky, yellow, green, or bloody. Some women see it only when they press the breast. Others find a stain on the bra or a spot on the bedsheet and brush it off. They assume it's hormonal or a reaction to a new bra or part of aging. But while not all discharge is dangerous, especially in women who are breastfeeding or pregnant, a discharge that occurs spontaneously from one nipple only, and especially if it's bloody or clear like water, should never be ignored, as your body doesn't leak without reason. Fluid emerging from the nipple could be a sign that the milk ducts are under pressure or invasion. Sometimes from a benign cyst or papilloma, but other times from a tumor growing silently behind the duct wall. And because many women are hesitant to even look at their nipples regularly, this subtle symptom often goes unnoticed. Then there's the matter of SS nipple retraction, where the nipple begins to turn inward or flatten. For women who've always had inverted nipples, this isn't cause for concern. But a nipple that suddenly begins to pull in on one side, especially when paired with other changes in the breast, like skin dimpling or swelling, can be a sign that something inside the brace is pulling or distorting the tissue. It may be a growing mass tugging on the ligaments connected to the nipple. Again, not always cancer, but certainly never something to ignore. And here's where it gets even more important. Many women don't want to talk about nipple changes because they're embarrassed. The nipple, like so many other parts of the female body, has been sexualized, stigmatized, and hidden. It becomes easy to delay conversation out of modesty or fear of being judged. But that silence, though understandable, is dangerous because SR cancer doesn't care about comfort zones. It shows up where it wants, how it wants, and it depends on our discomfort to stay hidden. Now, let's talk about color and skin changes around the nipple and areola. Some women notice darkening or lightening. Others may see flaking, scaling, or itchiness. And often, this gets dismissed as dry skin or an allergic reaction to soap or laundry detergent. But in some cases, particularly with a condition known as Paget's disease of the breast, these are signs of cancerous cells near the surface of the nipple. Paget's is rare, but it often masquerades as something minor like eczema. It usually appears on one side, doesn't go away with creams, and may be accompanied by tingling or burning sensations. It's this tendency to assume the harmless explanation that delays diagnosis. Women think they're being smart by not overreacting, but sometimes what feels like strength is actually avoidance. And that avoidance can cost precious time. Here's something I've always believed: the body doesn't whisper for no reason. If something feels different, acts different, or looks different, it deserves your attention. It doesn't mean panic, it means presence. It means choosing to be in relationship with your body rather than distancing yourself from it. Especially as we age, we have to shift from judging our bodies to listening to them. Your body is not failing you. It is informing you. And let's not forget that these signs are often easier to detect than a deep lump. That's what makes them so powerful. You don't need fancy imaging or expert palpation. You just need a mirror, a moment of attention, a commitment to self-respect. So what can you do starting today? Make nipple observation part of your self-check routine. Look at both nipples. Note any discharge, crusting, pulling, or color changes. Notice whether your nipples react differently when stimulated by touch or temperature. And most importantly, talk about it. Speak to your doctor, no matter how small or silly the change may seem. There is no shame in vigilance. Because the reality is this: the sheer nipples are not just aesthetic, they are anatomical beacons. They sit at the center of the breast and are often the first to respond to change beneath the surface. To ignore them is to ignore one of the most accessible, visible diagnostic tools your body offers you. So I'll leave you with this one powerful, personal question. If your body is trying to tell you something, are you willing to listen? Don't wait until the signs grow louder. Listen to the quiet changes. They may be the first chapter in a story your body is trying to rewrite with you as the survivor. As let me tell you something that rarely gets said out loud. As breast cancer doesn't always start in the breast. Sometimes it whispers through the body in ways that seem disconnected, even ordinary. And one of the most deceptive disguises it wears is the mask of everyday fatigue, back pain, or that dull ache we brush off as age or stress. Think about it. We live in a culture that normalizes exhaustion. We praise people for pushing through pain, for staying busy, for being productive even when their body is clearly begging for attention. So when a woman in her 50s or 60s feels persistently tired or starts experiencing unexplained aches, she often chalks it up to menopause, lack of sleep, or the natural wear and tear of aging. She may even blame herself. I should exercise more, or I've just been too emotional lately. But when fatigue doesn't improve with rest, when it becomes the backdrop of every day instead of the exception, that's your body raising its hand. When back pain doesn't trace to any recent strain or injury, when it feels like it's radiating deeper, like something in your spine is being pushed or pulled. Yeah, that's not just stiffness. That could be something else entirely. Because in certain cases, these vague systemic symptoms are how metastatic breast cancer makes its entrance. Metastatic cancer means the disease has moved beyond the breast, often to the bones, liver, lungs, or brain. And here's the difficult truth. It doesn't always give you clear warning when it spreads. Sometimes it shows up as a relentless heaviness in your back, or a quiet, stubborn ache in your ribs, or extreme fatigue that makes the most basic tasks feel monumental. This isn't the fatigue you fix with a nap. It's the kind of exhaustion that lives in your bones, as if your body is trying to fight something big in silence. Now, let me be clear. Not every back itch is cancer. Not every spell of tiredness is something sinister. But what I want you to walk away with today is the realization that, you are the expert on your own energy. You know when something feels off. And you know when that feeling lingers, when it resists explanation, when it doesn't go away after a good night's sleep, a change in routine, or a few days of rest. There's a deeper reason why these signs often go uninvestigated. We've been conditioned to view pain and fatigue as personal weakness instead of potential clues. We think admitting discomfort makes us a burden. We don't want to bother the doctor over just being tired. But silence is not strength. It's surrender. We also live in a society that trains women, especially as they get older, to deprioritize themselves, to focus on their children, their partners, their work, to accept pain as a natural part of aging rather than a sign worth investigating. So what happens? They don't say anything. They push through. They wait too long. And sometimes, by the time they speak up, the disease has already taken root in places that are harder to treat. Let me flip that narrative for you. Sarah, listening to your body is not weakness, it's wisdom, it's intelligence, it's power. In fact, it might be the single most life-saving decision you ever make. And here's another important piece, Azazer weight loss that you didn't try for. I've had patients say, oh, I've lost 10 pounds. I guess I'm just not as hungry these days. And they smile like it's a bonus. But the question is, why aren't you hungry? What's changed? When the body loses weight without your effort, that's not a victory. It's a signal. Often it's the body's metabolism reacting to an internal battle. In the context of potential cancer, that signal is critical. So what do we do with all this? How do we not fall into the trap of anxiety or constant self-diagnosis? The answer isn't fear. It's awareness. It's developing a relationship with your body built on curiosity and care, not judgment or dismissal. Start noticing the patterns in your body. Keep a small journal, even on your phone. Track how often you feel unusually tired, when your back pain started, whether it's constant or comes and goes. If you see a pattern, if it persists beyond a few weeks and can't be explained by activity or lifestyle, bring it to your doctor. Speak plainly. Be insistent. You are not overreacting. You are participating in your own survival. The greatest tragedy is not that cancer exists. It's that we often miss the chance to catch it when it's still whispering. The body speaks long before it screams. We just have to stop tuning it out. So I'll leave you with this. It says, don't wait for pain to become unbearable to believe it's real. Don't wait for exhaustion to become disabling to admit something's wrong. Your body is not betraying you. It's trying to save you. But you have to listen.